Hello. Thanks so much for coming today and keeping your appointment, Miss Joanne.
Thank you.
Today we're going to do a history and a physical history and interview about your health. I'll ask generalized questions and it will get then more specific about your health, physical and mental health. Is that okay?
Yeah.
Okay. So please tell me what's your full name
Joanne.
and last initial,
Joanne.
and your last initial is?
L.
Okay. And your primary language is English, Arabic?
English.
Okay. And what age are you, please? How old are you?
61.
And your birth date, please?
11. 23. 58.
Thank you. Where were you born, your place of birth?
Tuskegee.
And what's the state?
Alabama.
Thank you kindly. And you are considered to, your gender is a female, male, or other?
Other female.
And then your race, please?
My weight.
Race?
Oh.
Are you Afro-American? Are you
Mm-hmm.
Hispanic?
African American.
Are you married, single, or
Yes.
divorced? Okay. And any cultural or ethnicities you have along with what you have being Afro-American? Any mixed cultural differences or origins at
Indian.
all? Indian, okay. Could you tell me your education level, your highest level completed, please?
Associates.
Okay. Your occupational level or professional level, career level? Okay. Do you have health insurance at this time?
Blue Cross.
Blue Cross, Blue Shield? Okay. Tell me, what's your chief complaint? The reason why you came in today?
Cholesterol.
Cholesterol. Is your cholesterol high or low?
High.
Okay, thank you. When do you think the high cholesterol started?
A couple of years ago.
Couple meaning 2 or 3?
2.
2 years ago. Thank you. History of present illness. Do you think that, how do you think that your cholesterol became high?
Not exercising properly.
Are you having any challenges at all with your eating habits? Eating fried foods or greasy foods or?
Lately, I've been off my regular eating habit.
Okay.
Been eating fried food.
Fried foods. Are you eating much more of greasy foods too? Hamburgers, french fries, fried fish, things like that, fried chicken?
Fried fish.
And fried chicken?
Mm-hmm.
Okay, thank you. Tell me this. Have you had this problem? What does this problem do with this high cholesterol? Do you feel any type of indigestion at all from this fried foods or greasy foods? Do you have any type of gastrointestinal reflux disease from this fried foods? Do you get any upset stomach at all from these fried foods? Do you get any type of abdominal stomach cramps or pain from these fried foods? Do you get any burping from these fried foods at all? Any type of excess gas you get from these fried foods at all? Gas, much more gas. Do you start belching or burping often with these fried foods or anything like that? Okay. Describe the character and location of the symptoms. You think that you have a lot of gas, so it's from your then GI here, rectum. And do you feel any type of gas pains at all, or stomach pains or cramps at all? Any type of sounds at all, or burping? A lot of sounds at all in your stomach? Do you feel like a lot of movement in your stomach, or gas pains? Does it hurt sometime? Just do you feel the gas movement around your stomach? Okay. Are you able then to expel the gas at all? Easily? Okay. Do you think that the pain you feel with the gas, the stomach movement, is it a pain at all in your stomach from 1 to 10? No pain at all? And then when you have this high cholesterol, are you having any type of acid reflux or any type of pressure or pain at all in your stomach that comes up to your esophagus and your neck or to your chest, or pressure at all?
Yep, sometimes.
Sometimes you do. You taste that kind of acidy taste sometimes?
Yeah, when I.
Okay.
It burns.
Does it burn? Okay. And does it burn in your chest, or does it burn in your neck?
Up here.
In your neck? Burning your neck. On a scale of 1 to 10, 10 being the most pain or most distress you've had, 1 being the least amount of distress you've had, what would you rate the burning sensation to your neck?
4.
About a 4. 4 out of 10. Okay. Tell me this for timing. We dealt with quality. We dealt with the region in your neck. We dealt with the severity, number 4. Now we need to know, we did also with the P, what brings it on, which is the acid, foods and high fried foods brings it on, and increased gas. Now let's deal with the T, the timing. About when did it start, the onset of this greasy, fatty foods and this acidy feeling you feel in your throat that feels like it's burning? When did that start about?
It happens like at night after I've ate something greasy.
Night after eating. And this has been going on for about 2 years, roughly, too, with the gas?
Just the winter.
The winter? Okay. Thank you kindly. Duration is winter. It started about the winter time. And it's been going on since the winter time now, since December then, roughly, or November, October? Around November of 2019, 11/19. And do you have it then every night? Do you have it only on the nights we eat greasy or fried or fatty foods? When eating greasy foods, eating fried or greasy foods, along with the gas as well, increased gas too. And what do you think this problem means?
I need to cut out greasy food.
Okay. We'll quote that as well in quotations because that's important. Tell me about your past medical history. List down, not across, about your medical history. Any type of medical diagnoses, high blood pressure, diabetes, high cholesterol during your lifespan.
High blood pressure.
Okay.
High cholesterol.
Okay.
Obesity.
Any type of, this is through your lifespan, and so no past problem with diabetes, no past other problems at all that you can recollect regarding your health in the past.
In the past, I've had migraines.
Okay.
I have sinus.
Sinusitis, okay.
And ear infections.
Thank you so much. Any injuries that you've had, any falls up the steps or down the steps, any type of car accidents you've had in the past, any past hospitalization in a hospital, inpatient setting, or outpatient.
Just having kids.
Okay, so past, how many children have you had?
Three.
3 children. And were they all vaginal deliveries or, okay, no C-sections?
No.
Okay.
Big babies.
And they were large babies?
Yeah.
How large were your babies?
The smallest was 7'8".
7'8" was the smallest. And what was the next baby?
The next one was 8'7".
That's a big baby. Okay. And the other baby?
Wait a minute. The next one was 8'3", and the last one was 8'7".
Okay. Those are large babies. They call it macrosomia when you have large babies like that.
I was such a little person.
Wow.
Big old babies.
Big babies. Well, you definitely opened up to allow the baby to come out. That's something to say about you, isn't it? I must admit. Any blood transfusions you've had? Any type of disabilities that you have currently? Problem with walking? Any type of disabilities? Any type of childhood diseases you've had? Any type of measles and mumps in the past when you were in childhood, or rubella? Any chicken pox have you had in the past?
Mumps and chicken pox, I think.
You had mumps and chicken pox. Okay, thank you so much. Pertussis, strep throat in the past when you were in childhood? No. Any surgery history at all? Any type of procedures you had in the past? DNC?
No surgeries.
No surgeries. Okay. No. Let's see. Any inpatient hospitalizations that you've had been in a hospital about in the past? Or
years ago when they diagnosed me with high blood pressure, they kept me overnight for observation.
For your high blood pressure there. Any outpatient visits you had to attend to go to for outpatient procedures? No? Okay. Sexual history said number of pregnancy was 3. Term babies, they all were 40 weeks or 38 weeks, 40 weeks, 37 weeks to 40. Okay. No preterm, they weren't early babies. Okay. And no abortions at all. Okay. Let's see here. And all your children, number of children living now. 2. Okay. So you had 1 passed, deceased. At what age was that?
34.
34. Thank you. Sorry, I would hear about that. Immunizations, your shot record. You had all your shots and booster shots and everything's up to date? Okay, well, your doctor would know about that as well regarding that. Any type of psychiatric history during childhood or adulthood at all? Any type of treatment for depression? Any type of schizophrenia in your family?
No.
Okay. For you personally, any allergies to any medications at all?
I'm allergic to penicillin.
Okay.
And Billy, what I'm allergic to? What's the other medicine I'm allergic to?
Any sulfa or sulfur drugs or amoxicillin, type of sulfobactrim, any type of...
I forget what the name.
Oh, you can find out. Let me know. I'll put penicillin definitely. What happens when you take penicillin? Your reaction when you have that one?
I had real bad stomach pain.
Stomach pain, severe stomach pain. We'll make a note about that reaction. Let's take a look here. Any allergies to any food at all or dyes? Any type of...
My stomach. Nope.
So your stomach, is it gurgling or moving because you're hungry?
No, it does that after I eat.
Oh, after you eat, you start having noises, hear noises after eating. Is it a gnawing feeling you hear sometimes? Like you feel like you're hungry even though you've eaten already?
Yeah, it sounds like a hunger pain, but I didn't just say something.
Sometimes you look for any type of ulcers at all too. You need to check, your doctor can check for that question mark. So see about that. It sounds like feels like you're hungry, you're saying, but you're not hungry.
Well, it sounds like
like you're hungry. Thank you. Sounds like you're hungry, but not hungry. Okay, I'll make a note about that as well. Thank you kindly. So let's see. Any seasonal allergies at all?
Yeah.
Okay. Put that in there as well. So currently, tell me your medications you're taking right now.
Cozar.
Cozar, C-O-Z-A-R, and what's the dosage, please? 100 milligrams. And how often are you taking Cozar?
One a day.
One LQ day, every day. Any other medications you're taking also?
Somebody.
Thiazide? Is it a water blood pressure pill or hydrochlorothalidone?
Yes,
or
water.
Is ACTZ you're taking? ACTZ comes in 25 milligrams sometimes, depending. Is it hydrochlorothalidone?
Hold on.
Okay. We'll find out here. So as she's going to get those prescriptions, I'll do a quick recap of the things here regarding that as well. About her allergies to environmental allergies, seasonal allergies. You know what she'll take for that. Does she take anything over the counter at all? Let's see. Thanks a bunch. I appreciate that. Thank you. So currently triamterene ACTZ. Okay. And let's take a look here. And you're taking here 37.5 and 25. So you're taking this Maxide. Okay. Okay, so I'll put a notation here. Thank you for that. I'll put Maxide here. And I'll put 37.5/25 milligrams. And you're taking one a day. That's your blood pressure and water pill there. Give that back to you. And then we'll do a little Sartan here for blood pressure here. Let's take a look here. Little Sartan here.
To calm me down.
100 milligrams. Blood pressure here. Take one a day. And then we already have your... There's the Cozar right here. Yeah. And the Max, I only taking 2 pills a day? Mm-hmm. Okay. Zyrtec. Oh, your Zyrtec too for your allergies, then environmental allergies or seasonal allergies. Zyrtec here comes in 10 milligrams. Mm-hmm. Okay. Thank you so much. That's every day. You take it every day or when you need it?
She told me to take it every day, but I don't think they work when you take them every day.
Okay, so you take it as needed then. PRN here. Thank you for that. So let's take any herbal vitamins or supplements, any type of melatonin at all.
I take omega-3.
Omega-3, okay. Fish oil.
And I take niacin.
And niacin 500 milligrams. 250 milligrams. Thank you, Kyla. And that's once a day. Mm-hmm. And the omega-3 fish oil, how many milligrams is that? 1,000 milligrams.
I take 1,200.
1,200 milligrams at once a day. Mm-hmm. Okay, thank you. Thank you. So let's take a look. We're taking care of that regarding current medications. Now we're on last examination date. The last physical eye exam was when? More than 5 years, more than 10 years, more than 2 years?
It was last year.
Okay, so 2019. And an eye exam. And when you had the eye exam, did they prescribe you eyeglasses or no?
No, I thought I had scratched my eyelid, but it wasn't scratched.
So for scratched eyelid, and they didn't prescribe you any eyeglasses at all at that time. No eyeglasses there. And then your last physical exam was when?
Last year in June.
June, so 6/2019. Physical exam, PE. And then, have you ever had a food exam dealing with food allergies at all? No? Okay. Your last dental exam, see about your teeth. Usually they want you every 6 months or so. It's a preventive measure. It was the last 2 years, 3 years or more, 5 years or more?
6 months.
6 months ago. And when you went, was there any type of cavities or any type of swelling of the gums or gum infection at all? Plaque buildup? So you had did they recommend then a deep cleaning, or they just said?
I do it every 6 months.
Every 6 months a deep cleaning? Mm-hmm. Okay. Thank you for telling me. Every 6 months. Let's see. Also, too, with that, any problem with your hearing at all? Have you had a hearing screen done?
Yeah, my ears are perfect. I'll never lose my
Wonderful.
hearing.
Wonderful. And you did have a hearing screen done. When was that done?
2 years ago.
Okay, so that was 2018.
Might have been last year.
2019, you think? Last year? Hearing screen? Check your
Yeah.
hearing out?
Yeah.
2019. Thank you so much. EKG at all for the heart? Put the lead stickies on your chest? June of 2019? Okay, wonderful. What about a chest x-ray to see about come in here, hold your breath, put this lead apron on you, and then they go out the room, take a picture of your lungs in the front and back, PA and lateral. Have you had that done? No? Okay. Pap test, pap smear test? You know when that was done, when they had you put in the stirrups? June last year? Wonderful. Have you had a mammogram done at all?
I just had one done
Wonderful.
This is March.
Yes, this is March.
January.
Oh, wonderful. So 2020. You're up to date on many things. That's wonderful. So your serum cholesterol is dealing with your blood cholesterol level. When did your provider get some results for your test for that? Blood test for your cholesterol level? When was that, roughly? Was it this year, 2020?
Last year.
Last year? Okay.
It was about 6 months ago.
Okay. So let's see here. 19. Okay.
Need to know what they were?
Nope, I'm going to write that down. 1 second. And then also, they did a stool specimen for you for occult blood, looking for blood at all. Have they had that done? Check your stool specimen. You put it on a little smear, and you send that in to your doctor there, the mail it in.
June.
That was in June of 2019. 6/19. You can, when you get a chance to find me the level of your cholesterol level, you can let me know what the level was at 300, or they want you below 200 as a standard for the total cholesterol level. As you're looking for that.
Why should be putting me on stuff here?
I'm sorry, what did you say to me?
Nothing.
Urinalysis. They check your urine at all. Dipstick. Sometimes they take a dipstick. Check for blood sugar, glucose. Check for leukocytes, infection. Check for any blood in the stool. That was done too. Okay. 6/19. Any past TB test at all? Tuberculosis test, lung disease test in the past? No. Okay. Let's see here. Any sickle cell at all? Disease, clubbing of the moon-shaped red blood cell. Any lead levels that the doctor has taken at all? Hematocrit. Did they do some regular blood work on you? The doctor, CBC, complete blood count, everything else, in the last 6 months with your regular levels, with your high cholesterol level at your physical exam?
Results. Here they are.
Okay. Can you just tell me what it is, please? Regarding your cholesterol level?
She just did it in October.
Okay, October, so 10. Thank you. And what was the level? Did it say?
My HDL was 4. Cholesterol / HDL.
Okay, HDL is a good cholesterol level. What was that?
4.3.
Okay.
My HDL.
Okay, so your HDL is good cholesterol level. They want you above 50 for women, and yours is 56. That's real good. Make a notation here. HDL, it's a good cholesterol level, and that's 56, so that's good. So then your total cholesterol level, let's see, HDL,
248, 240.
240. So cholesterol level here is 240. A little bit elevated. They want you under 200. Then you have here your triglycerides. They want you below 150, and yours is a little bit elevated, 167, so it's a little up. And HDL, LDL, where's that? Here it is here. So not too bad. LDL, they want you below 100, and yours is 150, so it's a little 151, a little bit up. Okay, thanks so much for that. Appreciate that. So let's see. Family history. Tell me, includes your parents and your grandparents, your spouse and your children. With your parents, any type of diseases at all, high blood pressure, diabetes, any strokes, any type of arthritis at all that you know of?
My dad had Lung cancer.
History, father of lung cancer.
He had a stroke.
Lung cancer here. Stroke.
He had heart disease.
And heart disease for father. Thank you.
My mom had arthritis.
Mother here. Arthritis. Okay. And with your grandparents, anything significant?
My grandma had breast cancer.
Past breast cancer here. And then with your grandfather, anything significant with his health at all that you could recollect?
These are my mother's parents. I don't know what my granddad had.
Okay. Mother's here.
My dad's father had breast cancer.
Breast cancer with your dad's father. Breast cancer, yes, dad. Okay. And let's see here.
Lay hands on him too. Lay hands on him.
And let's see here. And then also too, so with your spouse here as well. Any illnesses at all with your spouse?
Billy has COPD.
COPD,
Yes.
Hey.
He has,
good to see you. Type of cholesterol, coronary artery disease, any past heart disease at all, any type of cholesterol issues, any type of
he has kidney problem.
Kidney, okay. Kidney failure or stages at all of kidney disease?
He's at 3.
3, okay. Kidney disease, stage 3, okay.
He has heart problems. He has a heart specialist.
Heart.
And
specialist here. Is he having arrhythmias, funny different heartbeats, skip a beat?
He has
arrhythmia, AFib.
AFib.
Okay, thank you. AFib. Okay, and then children. Type of health illnesses with your children at all?
The ones that's living, they both has high blood pressure.
So high blood children here. High blood pressure. Okay. Thank you. Next question, dealing with health conditions under family history, familial and any type of communicable diseases that they've had, TB, tuberculosis, any type of disease in your family? No? Okay. Let's see, next question. You said your family member 1 is deceased right now, is 1 son deceased here and 2 living. Thank you. Okay. Lifespan, let's take a look. Immigrant status, you're a U.S. citizen. Okay. Spirituality or religion?
Salvation.
Okay. And are you Christian or Muslim?
Christian.
Okay. All right. Next questions. These are done here. Thank you. So, health perception. Do you consider your health as overall health, mental health, physical health together? Is you consider it good, fair in the middle, or poor?
Good.
Good. Okay. We'll quote that as well. Nutritional patterns here. Appetite. Any changes in your appetite at all?
In the winter, I eat more.
Winter, eat more. Okay. In winter, eat more. Okay.
And gain weight too.
And gain weight too. I'll put that in 2. Okay, as for changes, satisfaction. Are you satisfied with the current weight you're at right now? No. What's your current weight that you know of right now? Not satisfied.
183.
183. The last 8 pounds. Okay. Any type of weight gain more than 10 pounds in 30 days, or weight loss more than 10 pounds in 30 days? Nope. Okay. Can you recall your usual intake pretty much of your food? Do you eat breakfast, lunch, or dinner? Do you do some extra snacks, or do you just 3 meals a day? Do you eat a lot of extra like Doritos, Cheetos, or other type of snacks? Or
I've been eating a lot of junk
food.
I never used to eat before.
Okay, increased junk food.
Um, a lot of fried food.
And fried foods. Uh-huh. So what they say pretty much they want us to eat more is chicken, fish, turkey. Ouch, ouch, ouch.
That's what I used to eat.
Okay.
But now, lately I haven't been doing it.
Okay. So they want to either bake it, broil it, rotisserie, chicken, fish, turkey. They want us to eat more fresh and frozen vegetables and fruits. They want us to eat more, less canned things, less canned because they have more sodium or salt content to help maintain the shelf life. These are the things they have determined to help us live a long time. Let's take a look here. Are you on a fluid restriction right now? How much water are you drinking a day, roughly, for fluids?
I drink 4 or 5 bottles of water.
Bottles, okay. Bottles of water daily. Any coffee a lot a day, or tea a lot, or caffeinated green tea? Is that green tea like a Lipton green tea with caffeine in it?
It's got caffeine in it?
Yeah. On the back of the bottle, it tells you about it. You need to read the ingredients. So look on the back of the bottle and read if they have any type of caffeinated or guarana, any type of caffeinated beverage in there in the back of the green tea. Okay.
I thought green tea was decaffeinated.
Sometimes Lipton can be caffeinated, or sometimes they can have decaf, depending. So you probably need to look at the bottle and see what the ingredients are. And she's looking for that to see.
It's healthy heart.
Okay. And it says on the back of there. They have certain kind of in the bottle you can get.
I can't see it.
Okay, let's take a look here. So green tea. This particular one says that it has, let's see, green tea, herbalent. Let's see here. And it doesn't seem to have any caffeine in here. So this particular one is not a caffeinated one at all. 100% natural, it says on the package. That's a good thing. Okay. Yay.
Because I was drinking coffee.
Okay.
But I stopped.
You stopped coffee. Okay. And how much were you drinking? Stop coffee here. A day?
A cup or two. I don't
1 to 2 cups.
really drink a lot.
Okay. Daily in the past. Recently stopped. Okay. Tell me this. Elimination patterns. How your bowels doing? Usual pattern. Brown color bowel movements every couple of days. No black, no green, no blood at all. Okay. Any constipation, any type of pain or straining with stool at all? Do you have any of that? Okay. All right. And brown here. Any bladder issues? Usual pattern with your bladder is to urinate a few times a day, every 2 hours or 4 hours or so. You go to